part of the urinary system below the kidney. Okay, so just a refresher, what is terahertz? Terahertz lies between the microwave and the infrared regions of electromagnetic spectrum. So this is a trillion. Okay, 0.1 trillion frequency. Okay, and this is what is known as a terahertz frequency. So primarily it's used for telecommunications, where they exceed microwave. They are also ideal for detecting substances. Almost every molecule has a fingerprint in the terahertz range. Now, telecommunications make use of microwave. If you have a 5G phone, that's microwave. 6G phone is just to help you see in context. Then you have the whole spectrum from very long wavelength, which are radio waves, to very short wavelength, which are X-rays and gamma rays. So visible light is here, from red light to violet, and visible light is only this bit. Longer than infrared will be terahertz between microwave, and so Wi-Fi is there. Terahertz. Okay, mobile is there. Now, breakthrough in terahertz technology come in the 1990s, where new techniques were developed to generate, monitor, and detect terahertz waves. And in 2011, the breakthrough came when terahertz wave was used to identify a painting, look at the painting to uncover. In the past, painting used to be painted over, and they were able to discover details below the surface painting. They were even able to discover the artist's name, which is hidden below the painting on the surface. So before this thing happened, nobody knows how to study terahertz, and this was called a terahertz gap. Why is there a gap? There was a gap because radio waves were studied under electronics, whereas X-ray, gamma rays, all that was studied under photonics, or the study of light. So what do you use to study terahertz? There was this gap there. Now, of course, photonics have come over to study this, and if you are aware, in China there's a lot of search on photonics. Now, right now, terahertz applications are in telecommunications. As I mentioned just now, 6G is in the military as well as security, where it can image, it can look through plastics, textile, paper, cardboard, it can look through a lot of things. Okay. So because it can look through a lot of things, it is highly secure. Even traditional scans cannot identify. Terahertz is able to do so. And in fact, it's so powerful that some people in the US say that it infringed privacy. So they seek to delay it. Yes and no. Even current scanning techniques, you can actually see through a person. Go to immigration, you know that, and they seem to have no problem with that. Then that's to do with security. In agriculture, in China, it's been used for monitoring drought, all this kind of thing. In health and science, scientists have been studying terahertz and look at the way it can image different parts of the body, especially tumors. It is of very high resolution. It can, for example, pick up the 3 layers in the bone. So it's very, very, so some people call terahertz the light of life. So the healing properties of terahertz come from 2 important characteristics of terahertz. One is that it gives heat, and heat can penetrate. Heat energy can cause cells to push out toxin and stimulate water molecule. And then there's this vibration. The vibration aspect is very important because for many, many years now, people have been using energy in the form of vibration field. And various frequencies have been identified. So energy medicine has now been very popular nowadays. You can even say that acupuncture, in some way, energy medicine due to vibration. So in medical usage, 2 medical usage. One is for diagnosis, where we use machines to image and look through, and we can see what's inside very clearly. The other one is used for therapy. I will say a little bit more about that later on. But the eye color care that we use is used to help us to become normal. So the property as far as therapy is concerned, low energy, so it doesn't ionize, so it doesn't cause your cells to mutate, become abnormal. You can say just now, it can penetrate through all these things and is absorbed by polar compounds. So the thing is, if it's a conductor of electricity, it will absorb terahertz. But any non-conductor, wood, plastic, paper, clothing, it can penetrate. And the energy is correspond to what in chemistry we call hydrogen bonds and van der Waals force. These are the same forces that are operating in terahertz water or alkaline water. Terahertz can change the shape of molecules. How it does so? Because it resonates at the frequency of cell. Okay, so biological systems can change as a result of terahertz radiation, and particularly in the case of certain protein molecule like neurotransmitters and receptors. Now the effect on the human body is on blood vessels, on water molecules which become activated, and inside the cell there are organelles called mitochondria, and this can increase energy production as a result of thyroid. And hyperactive cells, inflammatory cells, can become normal as a result as the influence of terahertz. And on DNA, it can actually unzip and activate DNA. So here are some pictures to show you the effect of terahertz. One is open up blood vessels. That's what it does, open up blood vessels. Blood, when they come from the heart, is under pressure. So water, all the good things, oxygen, nutrients that you eat and digested leave the capillary. So beyond that, because it's no longer the effect of the heart and the pumping action of the heart, the pressure become lower, and so water, waste products, carbon dioxide get absorbed into the vein. So because it's no longer under pressure, you find that there's a lot of water, there's a lot of waste products still gathering around, and that's why we have this lymph vessel, basically drainage vessel, drain away all the waste product, all the excess water, all the carbon dioxide. So open up blood vessels. Then it regulates inflammatory response. So in the bloodstream there are a lot of cells that cause inflammation. They're there to protect us, but sometimes they're hyperactive. When they're hyperactive, then you have diseases caused by excessive inflammation, and terahertz is able to regulate them. So diseases that cause excessive inflammation, like autoimmune diseases, lupus, rheumatoid arthritis, calm down. The inflammation get reduced as well of terahertz. Normal cells, in a normal cell you have this thing called mitochondria. The mitochondria, you can think of the mitochondria as a factory for all kinds of activities in the cell. It can, for example, transport things inside the cell. It can metabolize, it can import protein, it can produce energy, and when the cell reach the limit of its lifespan, it causes the cell self-destruct, called apoptosis. Okay? So when the cell reaches lifespan, a human cell lasts about 120 days, and beyond that, the nucleus began to disintegrate, and the cells began to send out protein molecules that basically send out signals, find me and eat me signal. Okay? So when other cells detect these signals, particularly certain white blood cells, they will destroy the cell, and that's how the body gets rid of cells that are too old. So this apoptosis in normal cells. Now, when it comes to bacteria, microorganisms, various viruses, parasites, and all that, the terahertz wave can stabilize it. That means they can destroy it. It's a very powerful thing, and a lot of infections can control by it. So it activates DNA. This is how it activates DNA. The terahertz is able to open up the DNA so that when the DNA is in a double helix, there's no activity. The DNA is not activated. But when it's open up, it can make RNA, which can go to synthesize protein. It can create another DNA strand so that the DNA can be duplicated. So terahertz is able to do that. So we're going to talk about the urinary tract. We're going to talk about urinary obstruction, diseases of the bladder, and then prostate and urethra. So lower urinary tract is ureter downwards all the way here, okay? And now we talk a little bit about the ureter. Ureter is the tube that connects the kidney to the bladder. And because it's just a tube, fairly simple, the most important thing is that it can get obstructed. It can be obstructed by many things. Calculi, which are basically stones formed in the kidney. It can be pressed on by various tumors in the stomach, in the abdomen, for example, tumors of the stomach, the colon, the liver, the pancreas. When they enlarge, they can press on it. And if you have an operational scars, that means the scars that form after the operation can cause the ureter to be obstructed, blood clots, lymph nodes due to cancer, and growth in females. Those who have suffered from endometriosis will have a lot of fibrous tissue growth, and this can cause the ureter to be obstructed. Sometimes there's a swelling of the urethral wall. This is only found near the bladder. Okay? Now, although stones, we think of stones as being able to block the ureter, very unusual do we see the ureter being blocked by stones coming from the kidney. That's because most stones coming down from the kidney are microscopic in nature. Those that are large tend to remain in the kidney, and we got to disrupt those stones in the kidney so that they pass out. So when there's obstruction, what happens? There's a lot of pain, changes in the urine output, you find difficulty in urination. So if one ureter is completely blocked, your urine comes only from the other kidney, and usually because if it's blocked, there's usually some injury to the ureter cells, and there will be blood in the urine, infection. And if the ureter is blocked, it impact on the kidney, and as I've said in my previous talk, it will cause the kidney to have high blood because kidney also control blood. So this is what ureteric obstruction looks like. For whatever cause, remove the obstruction and put it back. Now notice that the ureter come here, and at this point you have the arteries here, and it sits on the edge of the pelvic bone. The pelvic bone is a circle, right? Circle. So here it sits on the pelvic bone, and this is where it can press. So in the female, when they are pregnant, the fetus, the baby inside the womb, can press on this part, can press everything against the pelvic bone, and that's where it obstructs. So a urethrosil is a set liquid within the ureter as it enters the bladder. So from the bladder side, because this is harmless, all you need to do is to remove it and everything will be okay.
Remove?
Yes, remove.
Oh, so this is for people with this condition, right?
Oh, this is to show you how the condition looks like.
I see.
If the doctor were to insert a tube, they can take a picture of what's inside. Then they can remove it so that it doesn't create the pressure on it.
Okay. Alright.
Because this thing can collect urine, and if it collects urine, you press on it. And the collection of urine can cause other problems. So these are ways of dealing with urethrosis. Bladder, most important is infection. And two other conditions are incontinence and overactive bladder, which I will discuss. Interstitial cystitis is a kind of inflammation not due to infection. So there are many causes of this. So I will not discuss a whole range of two. You must be aware that sometimes your inflammation of your bladder is not due to infection, due to other, can be due to a catheter, can be all kinds of things that you may put into the bladder because whatever thing. So and there's of course bladder cystitis, infection of the bladder and the lower urinary tract often leads to a bladder. It's commonly in female. Male have a 3% prevalence. In the female, at least 20% of females would have a urinary tract infection. In fact, a lot of times 80% of urinary tract infection in the female are recurrent. Again, commonest is E. coli. That tells you E. coli is a bacteria commonly found in feces. So if the infection is by E. coli, it means that somehow material from the feces enter into the bladder, and I will show you why it happens. Then another commonest cause of urinary tract infection is sexually transmitted diseases, especially gonorrhea and chlamydia. Of course, if you have diabetes, if you have immobile, you have an indwelling catheter, or your kidney stones, it make it worse. So urinary tract infection can be asymptomatic. In other words, you can have the infection without knowing it. So this happens all the time. For example, a female or male can be infected without showing any symptoms, and through sexual intercourse, pass on to another partner, and then the other partner get it, and then they each can blame one another because it can be easy. And you can imagine the kind of hilarious thing. And sometimes when you investigate, you realize that it may have occurred through another source. During pregnancy, infections are more common because of the pressure of the fetus. Okay? Now, this diagram helps you to show you why it is more common in a female. You look at the urethra in the female. It's very short and it's directly kind of face to the exterior. So from the exterior to the interior of the bladder is a very short distance. In the male, the urethra is very long. So that's why it's less likely to have infection. The thing you notice is that the sexual organs are separated from the urethra. Okay? The uterus is here, the vagina is here, and this is the urethra. In the male, sperm is carried from the testes through what is known as the vas deferens. And look at the journey of the vas deferens. You go up, go round, come back, and join the urethra here in the prostate. Because of the long distance and because it joined the urethra again, the sexual part, the sexual organ of the male and the urethra are together, and that's a very important difference. Okay? And that accounts for all the kind of differences you see between the male and the female. Okay, so what are the symptoms of urinary tract infection? Very simply, pain during urination, and there is an urge to urinate called frequency. You go to pass your urine many times. Inability to start urinating, they cannot initiate. They feel the urge, they feel the need to pass, but nothing comes out, or the urine stream is very slow, or there's leakage. And sometimes there's a need to urinate and nothing comes out. Blood in urine sometimes is seen in urinary tract infection, and there's usually a lower abdominal pain. So the urine is usually cloudy, there's a smell, and if it spread to the rest of the body, if the infection spread, the fever, chills, nausea, vomiting, and of course back pain. So what do you do for urinary tract infection? You find that you can do a urine analysis, and you will find during urine analysis there will be white blood cells and see, okay, and bacteria can be identified if you send for microscopy. Okay, culture to identify the organism responsible. So you take the urine, centrifuge it, get the bacteria and culture it. Then you can image, do a scan to detect any abnormalities in the bladder that may contribute to the infection. And the treatment for urinary tract infection is of course antibiotics. So recurrent infections that occur frequently, as in a female, you may need long-term low-dose antibiotics, and in menopausal females, you may need to do some hormonal therapy in order to get it back to normal. And of course, you need medication to relieve pain, and you need lots of fluids in order to drain out all the excess pus and all that. So these are some pictures of urinary tract infection. So pyelonephritis, we say last time, is associated with kidney infection, urethra, bladder, urethra, urethritis. So the symptoms of urinary tract infection, being painful or burning urination, constant urge, bloody urine, foul odor, and women pelvic pain. So how do you prevent? I think because the genitals are involved, cleanse your genitals before and after sex, urinate immediately, wash your rectum. That's very important to the females. After you defecate, it should be wiped backward, okay? So that any contamination from the rectum is pushed to the rear instead of wiping forward, where the contamination of the rectum can be passed to the urethra. Bring lots of water and don't hold your urine. Urinary incontinence. Urinary incontinence refer to urine leaking by accident, and is particularly worse with age. The older you are, the more likely you get incontinence. And in the females, multiple pregnancy can lead to this kind of multiple pregnancy, cause the muscles of the pelvis to be weakened. When you have a leaky urine, it's not only aggravated by age, but any movement that causes pressure in the abdomen, such as coughing, sneezing, laughing, lifting heavy objects, will lead to leaking. And so as a result, this leaky urine is very embarrassing, and it often leads to restriction of activities and a negative quality of life. People with such problems usually are very shy about going out because they need to go to the toilet ever so often. And the important thing is to find out whether there's infection or not, whether there are contributing causes. Sometimes it can point to other conditions that will be present, and the urologist often will look at how the urine and the flow is. So you may need to study how the urine flow is from the kidney downwards, so they understand how it flows. So in overactive bladder, is involuntary muscle contraction. It can lead to incontinence of urine. You find that you pass out water many times, both in the day and night. It's associated with alcohol, caffeine, and any medication that induces urination, and it's associated with conditions in the nervous system as well as that. The key feature of overactive bladder is a sudden urge to urinate and unable to control the urination. Well, how do you manage incontinence? First thing is medical treatment. You must know what are the aggravating factors, whether it is, whether any neurological condition, and look at the diet and drinking behavior. Anything that stimulates the bladder, alcohol, coffee, and so forth. And avoid those drinks that induce urination. As I mentioned, coffee, alcohol, similar. Then you need behavioral management, and I shall talk about this later. Nerve stimulation treatment, nerve stimulation is to stimulate nerves so that the urination will be more normal, and for sometimes surgery can be indicated. So behavioral management, you restrict food and drinks that cause diuresis, and it's recommended that you keep bladder diary. Double voiding is often useful. Double voiding means after you void, you wait for a few minutes and void again. This ensures that any urine that is left in the bladder after you voided can be voided completely. Time urination, it is recommended to people with incontinence and so forth every 2 or 3 hours to go to the toilet. This helps to prevent dribbling as a result of overflow. Kegel exercises. Kegel exercises exercises of the pelvic, so which women who are pregnant, during pregnancy, they learn this kind of. But these Kegel exercises can strengthen the pelvic muscle that can control urinary incontinence. Okay, and of course, use of biofeedback. Both infrared waves have been used, both near infrared and far infrared. And of course, our terahertz is far infrared. So therefore, terahertz can be used for incontinence and can help us to get control and get the muscles of the pelvis as well as the bladder to regain the control once again. So that's behavioral management of incontinence for you. So these are the types of incontinence. Stress incontinence due to abdominal pressure. This is in the female. When there is pregnancy, there is a lot of pressure and you're stressed. This urgency incontinence is as a result of infection or as a result of stones or whatever. You feel the urgent need to empty your urine. Mixed combination of the two. Overflow incontinence is when the bladder don't completely empty. So you can get incontinence as a result, dribbling as a result of there's always water inside. This is about overactive bladder. So in overactive bladder, before even the bladder is filled up, it will contract and it will then pass out. So bladder dysfunction, you feel the need to pass out all the time, and very hard to initiate. That's what hesitancy means. Difficult to initiate, and you dribble urine. Then you can be very urgent and you go to the toilet many times, you can be incontinent, wet your panties or underwear fully. So these are all the result of urinary incontinence. Bladder cancer is the 10th most common cancer worldwide. 5th most common in women, men 5th most common, women 70% most common cancer. In other words, there's more often in men than in women. They affect older folks. 90% of bladder cancer are over 55. Average age of bladder cancer patient 73 years old. Most important risk, smoking. This is the number one cause of bladder cancer. Workplace chemicals. You are exposed to toxic chemicals in the workplace, you're also likely to get 5-year survival rate. If it's just local spread bladder cancer, your 5-year survival is 71%. Overall average is about 55%. So very good outcome generally speaking. Okay, and because it's a surface cancer, the bladder is very easy to visualize. When the urologist puts something into the bladder to look inside the bladder, you can see the cancer straight away. So it's normally detected very early. And the earliest signs is blood in urine, frequent urine, difficulty in initiating, dribbling, burning sensation when urinating. So this is a cancer that is easily detected and normally detected early and therefore have good outcome. Okay, so let's move on. These are the symptoms. The blood may be microscopic, so you can't see it, and when you have urinary symptoms and you examine under the microscope, you see the red blood cells in the neck. Or it can be gross hematuria, so that means frank blood coming out, and you go to the toilet many times, you have the urge to pass but no urine, that's what hesitancy is. Nocturia, that means frequent urination at night. Lower back pain, these are all the symptoms of bladder cancer. And when you look at the urine, there are plenty of red blood cells, and you also see cancer cells in the urine itself. So sometimes if the cancer has spread, you find that there may be pain in your bones, you may have abdominal pain, and you may have jaundice. That means the cancer has spread to the liver. So treatment is by surgery or by the use of radiation. The radiation can be from external, or you can actually put radioactive pellets in the bladder and within it. Chemotherapy, same thing. It can be systemic, that means from outside, or you can introduce the chemotherapy drug inside the bladder, intravesical. And then there's targeted immunotherapy, that means you use certain immune cells to attack the cancer. Okay? And this is one of the latest advances in cancer therapy, where the treatment is targeted as a specific protein enzyme that are involved in the cancer growth, in the growth of cancer cells. Okay? And of course, terahertz waves can modify cancer gene expression. That's why terahertz wave is useful. Can support whatever treatment you're getting by using terahertz wave. Okay, so stages. This is what bladder cancer looks like. It's in here inside. And if it's very localized, it's the best. Or it's spread to other tissues, stage 2, and then it's spread to other parts, then this is not. So advanced bladder cancer, urination problems, pain, weight loss, or loss of appetite, feeling very weak, or fatigue, bone pain, swollen feet because of the pressure. Disease of the prostate, the three main things: infection, benign prostatic hyperplasia or BPH, and prostate cancer. So prostatitis and urethritis usually occurs together because the prostate is part of the tube coming down from the bladder. So catheter, biopsy, or sexually transmitted. Now, in older men, chronic prostatitis can occur as a result of previous. Prostatitis and urethritis are totally unrelated. The symptoms include frequency of urination through urgent night urine, painful urine, pain in the genital area, abdominal and back pain, fever, chills. These are the usual symptoms that occur in the lower urinary tract. And prostatitis is always associated with urinary tract infection, particularly urethritis, and they're often treated together. Urethritis can lead to strictures, cause blockades, and it's very painful. And the only way to treat urethritis where there are strictures is to open up by forcing it open so that it becomes pain. In the past, this is seen quite often because of gonorrhea. Gonorrhea causes these strictures. Benign prostate hyperplasia or BPH is a non-malignant growth of tissue enlarging with age. For males, if you live long enough, you will always get BPH. It's a fact of life. So at 50 years old, 50% of men get it. By 80 years old, 90% of men. And those that they don't have symptoms, their prostate have shrunk due to treatment or is associated with presence of testosterone. How do we know? Men who are castrated, and so testosterone is no longer present in their blood. They don't get prostate enlargement. Diabetes, obesity, heart and circulatory disease aggravate. And that's very interesting. If you have heart disease, chances are you will have some problem. So the prostate can lead to blockage, the urethra, urine retention, dribbling. Symptoms of prostate enlargement: frequency. You urinate very often. The urgency, you cannot delay. And there are very great difficulty starting a urinary stream. And if you go to a male toilet, you find that a lot of old men just stand at the urinal for a long time to urinate, and that's because of the difficulty initiate. Very weak interrupted stream, dribbling, incontinence, nighttime urination, urinary retention. Now this is very important. In the good old days when we don't know much about prostate enlargement, and as medicine began to improve the lifespan of people, and because they live longer, as we said just now, if you live long enough, a male will get prostate enlargement. You'll find a lot of males coming in with urinary retention. They can't pass water for more than 24 hours. That means they tried to pass but they couldn't pass, trouble initiating urine. So they'll come to hospital, and the history is typically at least 1 day, sometimes 2 days without urine. And when your abdomen is enlarged, and the bladder is very huge, and in those days I was working as a houseman and surgeon. When these people come in, all we need to do is to pass a catheter inside and drain the thing. Be amazed. 1 liter, 2 liters, not uncommon, sometimes 3. There's so much urine. So nowadays, of course, when you have difficulty urination, you go and see a doctor and find out that yes, your prostate is enlarged. And other things that also affect pain after urinate. So when the urethra, when it's blocked in the prostate, your bladder walls also get overworked, and sometimes they get weakened also. So blocked urethra, urinary retention, blood in urine, urinary infection. Yes, so if the urine is collected, then of course a collection of water always leads to infection, and bladder and kidney, and if your urine is concentrated, of course it produces stones. So that's where the prostate is, just below the bladder, and as you can see here, the urethra passes through the prostate. Now when the prostate is enlarged, it narrows this. That's where urinary retention takes place. Okay, and if you put in a thing to take a look, it looks like it should be an open hole, but the two sides just come together and block. So that's why they have difficulty and all that. Obesity and type 2 diabetes. So generally that's true. Come to think of it, there are a lot of the patients that catheterized, collect so much urine, they tend to be on site. So you can diagnose by putting a finger inside there, you can view the prostate, or by doing an ultrasound scan. Nowadays there are very good ultrasound actually scan the entire prostate to see how big. So how do you handle enlarged prostate? Very simple. There's a lot of medication used, a lot of lifestyle change that you can do, and now a lot of procedures are done by putting a cystoscope through the urethra. Now, last time it was above from the abdomen, so you're going to cut through the bladder wall and then you're going to stitch up the bladder wall. But now they can go through the urethra, and so it's minimally invasive. And what can you do? You can remove prostate tissue by using ultrasound, heat, water, vapors, laser. So you put a tube inside at the level of the urethra, at the level of the prostate, you can do all these things. THZ support or device actually support the treatment of prostate surgery. That's what it means. The tube is injected through the urethra and then deal with it. This is an older technique. The penis is here. This is the pelvis. You see that the prostate is behind the pelvis. So it comes in from the abdomen. This is an old technique. And then you can remove or shrink the prostate gland. Now this what happened when we use various techniques, lasers, water vapor, hot water vapor. So this is a tube that insert in the urethra, and you see this thing coming out. So you can spray laser, ultrasound, whatever, to destroy the prostate tissue and shrink the prostate. So this one side, this the other side. Amazing that we can do this nowadays. There are several fruits that aggravate prostate. Your prostate will be worse if you consume things like eggs, honey, red meat, alcohol, sugar drinks, hydrogenated like margarine, trans fats, spicy food, and foods that help you to have a normal prostate, mainly fruits, vegetables. Cruciferous vegetables are those with a crust when you cut through the stem, broccoli, kailan, things like that. Garlic, onion, these are all food that are antioxidant and protect you against cancer as well. Coffee protects against prostate megaly. Interesting. So does green tea, nut, avocados. A urologist, I put this lemon rinds there. A urologist discovered that the skin of the lemon, he kind of used what do you call that? One of those things that...
blender. Blender.
Blender. He blended lemon rind and other fruits together, and it seems that it's quite powerful at causing the prostate to regress, come back to normal size. I haven't tried it myself, but it should be quite interesting. So lifestyle changes for prostate, enlarged prostate, what can be done? Cyst baths. Cyst baths are a very shallow basin. Hip gains a bag filled with warm water, and basically you kind of soak bottom of your buttock in this shallow basin, and it seems to improve. Consume fruits, vegetables, maintain a healthy weight because prostate enlargement is associated with obesity. Regular exercises and keep fit. Pelvic floor exercises, Kegel exercises. As I said just now, these are exercises females do during pregnancy, right? To strengthen the pelvic muscles. And in elderly females also, you need to do this kind of exercises because of the incontinence. So in a male with prostate problem, this kind of exercise. Avoid cycling. Okay. It's been found that cycling, especially if you cycle long distance, affect the prostate gland by causing perhaps damage or harm. And the prostate-specific antigen PSA, a substance in the prostate secrete when it's damaged, is high. So then this technique for coping with incontinence, urinary incontinence, whatever the cause, urinate a fixed interval and double voiding. Fixed interval means every 2 to 3 hours. Double voiding means after you void, you wait for a few minutes and void again. So any excess water, urine in the bladder remove. And this coffee, while it helps you not to have a prostate, when you have a prostate, coffee and alcohol, because it irritates the bladder, make things worse. So zinc supplement according research. So a very important consideration for men is erectile dysfunction. And what we know is that enlarged prostate can aggravate erectile dysfunction. Conversely, erectile dysfunction can lead to prostate enlargement. Worsening enlarged prostate can lead to reduced sex drive, and treatment for enlarged prostate can lead to erectile dysfunction. Cialis, which is a drug for treating erectile dysfunction, have this activity that it can improve both prostate enlargement as well as erectile dysfunction. And medications for erectile dysfunction can be safely used for prostate, and both share common aggravating factors like diabetes and heart. So people with heart disease will get this problem. See, in fact, you can safely predict that if a person has high blood pressure, that he will have erectile dysfunction and prostate, almost definite, I would say. But the good news is that our THZ laser have a positive effect on both prostate enlargement as well as erectile dysfunction. And that's the good news, I think, and why we should use this. Okay. Let me show you one slide. In case you have people, you know that prostate is here, right? This is the bladder, isn't it? Now, if you blow in this area, it may or may not hit, but there will be urine here, right? So when you blow your thing at water, what happens? The water becomes charged, isn't it? So if the urine becomes charged, it will also affect. So I reason myself, as a scientific person, because surgeons use this route to reach the prostate. So you can actually, in the instruction manual, you are told to blow here, okay? But if you look carefully at this thing, it goes into the prostate here, right? So if I blow here, in other words, below, from the side, because erectile dysfunction, prostate enlargement share a lot of common factors, this thing also works, and also from on top and down. So I figured that out, that these are the areas, because it is so small. The size of the walls, have you seen a walnut supermarket? That's the size of the normal prostate. So it's very inaccessible. So I thought these are alternative routes. This is very useful, and this is a route that you can use for prostate massage. In the good old days, people do prosthetic massage through the rectum. There is internal prostate massage. External is on the skin here. So these are ways whereby we can help people with prostate enlargement to be relieved. That is a question I'm glad you asked, and we can talk about it.
Yeah.
Okay, here, right? Okay, prostate cancer. Prostate cancer is the second most commonly diagnosed cancer in here. It's very common, but the good news is a slow-growing cancer, and it's curable with early diagnosis. In the US, it's the second leading cause of death. Survive very well. 95% survive after 5 years. The risk for prostate cancer, age, obesity, and family history, as well as exposure to certain chemicals. Okay. Now, there is a common belief, and it appears to be supported by some studies that show that the frequency of ejaculation in men will reduce prostate. That is to say that if men regularly have sex or masturbate, then prostate cancer chances will reduce. Well, there may be some truth to that. Cycling and prostate cancer, no correlation this time. There's no such correlation. This is on the Singapore cancer rate. In Singapore, it's the second most common cancer diagnosed. And cause of that, in males, you find prostate cancer isn't there. So in other words, those who are diagnosed with prostate cancer don't die of prostate. That's the good news. You can live long. Recently, you may have not seen, those who have read the local newspaper, there was a prostate specialist, right? A urologist who was diagnosed to have prostate, local doctor in one of the hospitals. So he was shocked by it, and because he himself is specialized in prostate cancer as well. That's the thing. So he said, well, the chances of me surviving is 50, because the survival rate is very. But he also realized that as a patient, how difficult it is to get good support and advice from his colleagues. So when a doctor become a patient, then they realize how tough life. So diagnosis, all the usual symptoms: difficulty urination, interrupted flow, painful urination, blood in the urine, painful ejaculation. The best way is to confirm. The best way to confirm the diagnosis is by doing a biopsy, and there are two ways of doing the biopsy. Complication: when a stone gets this is not part of it. There's this PSA. PSA antigen is secreted by the prostate. Normal PSAs are less than 1 nanogram, but it tends to rise, and we look for a steep increase. But PSA is not diagnostic, because you can have a low PSA and still have prostate cancer. Conversely, you can have a high PSA and still not be cancer. So it's not non-specific, and so that's why we look for steep. The PSA increase very sharply. Usually that's an indication, and we confirm it by doing a scan, MRI, CT, or PET scan to determine how much it's spread. Of course, isotope bone scan, there's bone pain indicating that the cancer has spread. So how do you deal with it? Surgery, radiation treatment, cryo is ice. You inject, I think it's liquid nitrogen, which solidify as a solid and is ice cold, lower temperature than ice. So we use chemotherapy, immunotherapy, and hormone therapy. And in prostate cancer, we can use high intensity focus on. This tells you something. Terahertz helps because terahertz is active against cancer cells, reduce the expression of cancer cells, and more importantly, terahertz helps cells. So biopsy, two routes, one through the rectum, transrectal, one from the perineal. So cancer starts this way and it spread the bladder to the surroundings. So here we talk about many conditions like incontinence, like prostate, like bladder problems, where terahertz is supposed to help. So I want to say a bit about laser. A laser beam in medical practice is a beam of intense light. It must be, number one, the same wavelength. You can have a few wavelengths all mixed together. And secondly, their peaks must phase. In other words, all the wavelength, all the waves, all their peak must be at the same time and then goes down. You know the wave, isn't it? You buy a fridge, they tell you inverse wave. Inverse wave, that means when it goes up and down, when it's up, they leave it up. When it's down, they invert the down to the top so that you have consistent energy. You get the energy of the down phase added. So by combining the light in such a way that the peaks are same, you have more focused energy. And you can use, in medicine at least, the frequency we use range from ultraviolet right through infrared, and even microwave has treating all kinds of conditions. And of course, the most important thing about this laser is that in the treatment of stones, kidney stones, stones anywhere in the body, in the gallbladder, infrared lasers have been used. Okay? Now, once laser have absorbed, it leads to decay, the decay of stones, tissues and all that. And the heat generated can lead to chemical decomposition, therefore melts down and it destroys tissue. The effectiveness depends on the power of. So this is what we call medical lasers. Medical lasers, intense light, one frequency, all the peaks in phase, and it must have enough power. Okay. Now this is terribly important. Your frequency can range all the way from ultraviolet to infrared and in microwave. Radio waves now. This is medical grade. This is non-medical. So you can produce waves, but it's of this kind. It's a spread. It doesn't have the effect of medical. Our terahertz wave is more like, because if it's medical laser, it's very focused, very intense, it will have to be regulated. The fact is, for home use, tell you that it's. Now this is terribly important. I hear that in some countries, people set up clinics, treatment centers, and use this trick. I think it's not right. Conversely, somebody from the US wrote to me to ask me some point, say that nobody wants to tell what to do because they're afraid of being sued. US, everybody sue everybody else. So this is the issue with regard to eye care, that because it is not medical grade, there are some things we can say and some things we cannot. It cannot cure. And I wouldn't say that, if you have heart disease or anything, just use this and don't see a doctor. I wouldn't say you need a doctor, proper diagnosis. And in fact, in some of the testimonies I read, they couldn't recover. They have to see a doctor. Why I know? Because I treated the condition before. You can't recover without doing other things. See? So there is a lot of promise for therapy. It can do a lot to improve your health, and that's what it's all about. It's a matter of balance, healthy lifestyle choices. As you can see, for a lot of things, a healthy diet, fruits, vegetables, things like that, fruits with antioxidants help you to have a healthy function. Even though you have a risk also, a happy, healthy mind, good healthy habits of nutrition, exercise, obesity, cause a lot of problems. In fact, it has been demonstrated. This study was a WHO study over many years, 10 years I believe, and they looked at it systematically, and they found that obesity contributes to all kinds of cancer. So no advantage where everybody die from infections and die from all kinds of things, and people die young by the age of 50 plus, they die off. Then maybe a little bit of obesity is helpful to give you that extra boost from nutrients that are stored in your fat cell. But nowadays, medical living longer, obesity is no longer an option. So take care of yourself. Nutrition, exercise is terribly important. Adopt a positive outlook. Take steps to lower your stress. Takes time to connect with your loved ones and yourself. This helps us, it has been shown that when I connect with more people, it supports my body's immune. Somehow or other, it helps. Be connected with, have a happy, healthy life. Be serious, but make sure you have lots of fun and laughter as well. And use steroids, repair and regenerate. Make you feel young. Suitable for all kinds of things. Skin, especially skin blockages, various pains. Not suitable if you're pregnant, disease, open wound. This is a big question here. I've seen several articles of late that showed that in open wounds, terahertz will promote wound healing. So that is contrary to what the accepted wisdom. But then that's where we learn open wounds. Well, this is a scan that I use to help detect abnormal body function. Okay, so we scan, and when you scan, show you what is abnormal. So it's very useful to know which part of the body is to scan in case you're not sure.
This for all the organs, is it?
All the organs, your entire body. And if you like what I give, support me by buy my books or sign up for some of the things I have. My mobile number is there and my email.